We'll start in just a few minutes. Welcome, everyone. We'll start in just a few minutes. Hi, everyone. I'm Lindsay Lyon, a managing editor at U.S. News and World Report. In today's webinar, we're exploring long COVID in children and teens. This event was developed with support from Texas Children's Hospital. You can learn more about today's speakers and all of our programs at usnews.com/events. We are recording video of today's session, as well as streaming on the U.S. News Facebook, LinkedIn, and YouTube channels. First, we're going to hear from Marcy Salagumba, mother of 12-year-old Bree, who has been struggling with long COVID since 2020. In a pre-taped interview with U.S. News senior health editor Shanley Chen, Marcy will share more about their difficult journey to healing. Then we'll hear from a panel of experts who've been leading pediatric long COVID clinics since the early days of the pandemic. Joining us are Dr. Amy Edwards, Director of the Pediatric COVID Recovery Clinic and Associate Medical Director for Infection Control at University Hospitals, Rainbow Babies and Children's Hospital. Dr. Uzma Hassan, Medical Director of the Pediatric Post-COVID Care Program and Division Chief of Pediatric Infectious Diseases at the Cooperman Barnabas Medical Center and RWJ Barnabas Health Facility. Dr. Laura Malone, Co-Director of the Pediatric Post-COVID-19 Rehabilitation Clinic at the Kennedy Krieger Institute, and Dr. Kristen Sexton-Techtel, Director of the COVID-19 Return to Activity Clinic and of Preventive Cardiology at Texas Children's Hospitals. Now Marcy will tell us more about how long COVID has changed life for her California preteen.
Marcy, I understand that your daughter Bree has been coping with long COVID for a few years now. But before we talk about her condition, can you take us back to 2020 when Bree was 9 years old before she caught COVID? What was she like as a kid?
Okay, so this is my daughter Bree. She absolutely loved school. She was a straight A student. She loved to read and do math, and even taught herself how to multiply before learning it in school. She was the fastest girl on our soccer team, you know, where she would be able to play the whole game, and she was just a natural athlete.
And then Bree got a mild case of COVID in March 2020. Although she bounced back quickly, you soon realized something else was wrong. Can you tell us what started happening? What symptoms was she experiencing, and how did you connect the dots that this was long COVID?
So she started with rashes all over her body. Her hands would wrinkle within 5 seconds of running them through water. She couldn't physically stand in the shower for longer than 5 minutes without getting tired or starting to have trouble breathing. And she would start complaining about her feet burning. And I even noticed that her legs and her feet would start turning red. She'd flinch and say ouch anytime we put our arms around, around her back. She couldn't stand on one leg without shaking uncontrollably. Her hands shook at random times. And there was one time in school where she was taking her lunch to the lunch tables when her hands started shaking, and her lunch fell over onto the kid that she was sitting next to. She couldn't play soccer longer than 15 minutes anymore. There were times where, she would be on the soccer field and she would actually have to guess where the ball was because, her vision started turning blurry and she'd start feeling dizzy. Bree was in so much pain that she couldn't get out of bed. She started actually missing 3 days a week from school. And every morning she'd wake up with a pain level of 7 out of 10, and it would pretty much just go up from there. Obviously her grades started dropping, not only because she missed school, but there were times where her brain fog was so bad that she'd forget simple math equations, just simple ones like 8 times 3. And, she'd forget what she just read, or she would just completely space out. So she just started having a lot of issues that were very worrisome.
That's a baffling array of symptoms that she's had to deal with for more than 2 years. And you and your family have clearly had to deal with a lot. So as you reflect on her long COVID journey, what would you say has been the scariest moment?
I was home, doing laundry, and I get a call from the school saying, "Hey, get over here quick. Your daughter's unresponsive. The ambulance is on the way." So apparently she had, passed out a good 12 minutes. They were trying to wake her up. She wasn't waking up. And, when they finally got her to wake up, she starts screaming and she passed out again. The EMT, they even at one point said, "Hey, can I give her fentanyl?" And obviously, you think of fentanyl, oh, it's one of those street drugs, but obviously, they told us, no, it's safe, it's the medical grade, it'll ease her pain. And it did nothing for her pain at all. She would still wake up screaming and just pass out. And it wasn't until she was in the hospital that they started giving her IVs and a whole bunch of other different things to try to bring down the pain that was finally able to, calm her down. But ever since then, it's been emotionally hard for us. We can't, or at least I can't, anytime she's in school, I feel like I have to be home because I cannot be more than 10 minutes away from the school because I'm afraid that it's going to happen again. So that's just been tough.
And given everything you've experienced with Bree's condition, how have all of those long COVID symptoms, her fatigue, the excruciating pain, the tremors, affected her life and her daily activities?
Well, at one point, she had appointments every single day of the week, whether it was with physical therapy, the chiropractor, acupuncture, or any other wonderful medical specialist, or just doing labs. She has to work harder to try to retain things. Although she's still a natural in sports, it takes her longer to, she has to take breaks longer, to catch her breath. And it's very frustrating for her because she used to be able to just go and keep going. And, any cold or sports injury takes her twice as long to heal.
Without access to a dedicated pediatric long COVID clinic, you've been patching together Bree's care. You're in and out of urgent care. You've seen countless specialists. You've taken Bree to massage therapists, acupuncturists, and chiropractors in hopes of easing her symptoms. What has this process been like for you and Bree?
So this is a 2-inch binder of all her medical records that I take to every single doctor appointment. It's been a little hard because when we were first told that, yes, she has long COVID, every single long COVID clinic that we found out there, they were only seeing patients that were 18 and older. So we had to pretty much see all the medical specialists, but not associated together. So it was hard, trying to just piece what one person was saying and making sure that the other doctor knew exactly what they were saying. And so I've been the one that's been telling the doctors, hey, this person said this, okay, this person said that, hey, this doctor doesn't want her to be on this medication, can we change it? And just even her pediatrician, we see him once every 3 months just to let him know, okay, this is what's going on, this is what everybody's saying. And it's hard. It's so hard to try to keep everything together and make sure that, okay, I didn't forget to tell them, hey, what, it's just been super hard.
Absolutely. And one of the hardest parts too is working and dealing with doctors who don't believe in long COVID or don't believe that long COVID is a real thing in kids and teens, which is something that I understand that you've struggled with and experienced too. Can you briefly tell us about that time a doctor you went to for help didn't believe you and Bree? What toll did that take on your family?
So we had a wonderful rheumatologist. She was working with us for a long time and she was just amazing, but she ended up having to go on her own medical leave. And we ended up seeing a different doctor from that facility. And he, without talking to my daughter, without talking to me, he comes into the room, and he tells us everything that the prior rheumatologist told you. She has none of it. She has fibromyalgia, but he said, kids do not get fibromyalgia. Only kids that have been physically and sexually abused get fibromyalgia. And the look on my daughter's face, just of confusion, and it was just, it was hard. It was so hard trying to explain to her, hey, don't worry, don't worry about this doctor, we're gonna go find another one. It was very tough for her.
Absolutely. And throughout the whole experience, you've tried so many things to get Bree's long COVID under control. So how is she doing today? What treatments have made a difference?
Okay. So she's 12 now. She's back on the soccer field. She hopes to be a track Olympian. She's still super fast and is actually being clocked at high school times right now. She does still tire after about 15 minutes or so on the field, but she is slowly showing signs of improvement. There's been a couple games just recently that she was able to play the whole time. So it's been a big improvement. We are starting to recognize more and more the signs where she's going to have a flare-up coming. So, we do make sure that if we see signs, we start giving her a whole bunch of sodium. We start giving her banana bags, liquid IVs, pickle juice, cup of noodles, but we do give her straight CBD. There's no THC, it's just straight CBD. And we have noticed that by doing that, it's made a huge impact on her, where the flares aren't as bad as they used to be, or they don't actually come up. It's been so much easier on her body now. She's been better.
That's really wonderful to hear, Marcy. In the moments that we have left, what message do you have for healthcare professionals? How can they better support kids and families dealing with long COVID based on your experience?
I guess it would be just to please believe your patients when they tell you that something is wrong. We are coming to you for a reason, and just because the labs are pointing that, hey, there's nothing going on, doesn't mean that it's all in our heads. We need help, and we have trust, and we have trust in you that you will find a way to help us out.
Please join me in thanking Marcy for sharing her family's story with us. Now I'll turn it over to Shanley and our expert panel. Take it away, Shanley.
Thank you, Lindsay. As we just heard from Marcy, long COVID is a puzzling condition that has left families and doctors alike with more questions than answers. We'll address the various challenges health experts face, the dizzying array of long-term needs of these patients, and discuss that path forward in treating long COVID. But before we dive into that, Dr. Malone, I'm hoping you can kind of set the stage for us a little bit. In the simplest terms, what is long COVID? What do we know about it? What don't we know? And frankly, what do we wish we knew about it?
Great question. So many people get COVID infections, including children. And so they may have a runny nose or a sore throat, fever for a couple of days or so, but then they recover. The long COVID is if they have persistent symptoms, or sometimes they may actually develop new symptoms that then last longer. So the CDC actually uses a symptom duration of 4 weeks of symptoms after the acute COVID infection in order to define long COVID. That duration changes a little bit depending on who you talk to, but there's some organizations that look for a little bit longer. And I think that there's lots of ongoing questions that are sort of in everybody's mind, and more research is needed. But I think some of the most important questions are, are there certain children that are more at risk? And what are the best treatments for children? And so I think that there's research ongoing to understand some of the mechanisms or causes behind long COVIDs, and there may actually be multiple that exist under this umbrella of long COVID. And so thinking about different phenotypes or sort of symptom presentations may be a way to understand how we best treat pediatric long COVID. And then sometimes with a better understanding of the mechanisms that underlie long COVID, we might be able to have more specific or precise treatment options for children.
Absolutely. And you bring up a really great point about risks and treatments, and we definitely want to get to that a little bit later on. And we will have an opportunity to kind of dive into that a little bit more. But, you know, as we heard from Marcy about her heartbreaking experience with that rheumatologist who didn't believe her, I know that, you know, you all have also experienced that some doctors are skeptical about long COVID in kids. Dr. Edwards, based on your experience, are you still finding that professionals in the medical community and really society at large don't believe that children and teens can get long COVID?
That I'm really glad that you brought that up, because the answer is absolutely yes. We hear all the time, oh, kids don't get COVID. Kids do get COVID. Kids can even have severe COVID. And in fact, children have died from COVID. And not all the children who have died from COVID had severe pre-existing conditions. Some were perfectly healthy kids. So along that same road, kids can get long COVID. But first, you have to get people to believe that kids can get COVID. And there is a segment of the public that still doesn't believe that. And then, yes, I have seen pediatricians, rheumatologists, immunologists all say long COVID is really associated with severe COVID in adults who have prolonged ICU stay. This is not a thing in children. This is depression, or this is anxiety, or this is somaticizing, or this is fibromyalgia, or pick a diagnosis. I've seen that again and again and again. All I can do is keep speaking out. And, I've done grand rounds here in my own hospital and in some of the surrounding hospitals. I've done news presentations and, anything just to try to get the word out. Long COVID is real. It is a thing that kids experience. And we have to help these kids, because otherwise, there's serious concerns about, what the long-term outcomes for these kids might be if they don't get help.
Absolutely. And for everybody else on our panel, have you experienced the same thing as well, or something similar in terms of other colleagues not believing that long COVID can happen in children?
We've had multiple referrals to our clinic for parents who are really frustrated, have been through multiple settings, multiple subspecialties, where they're told this illness is a figment of the child's imagination, that they're pretending this is all school refusal. They just need to, get their act together and get back to school. And it's really frustrating. I think we have our work cut out for us to kind of create awareness that this is the real deal. These children are really struggling. And if we don't offer them the support in the right time, they're going to get worse, and it's going to be tougher for them to get back to normalcy.
Absolutely. Dr. Sexton-Tuchtel, I saw you nodding your head there for a moment. Was there something else you wanted to add?
No, I think they both have really hit the nail on the head. I think that a lot of what we're hearing here is parents saying how frustrated they are. They've been passed around. No one believes them. They've gone to many different physicians, and it's just a constant struggle to find the right place with the right people to get the help that they need.
Yeah, I can't tell you how many parents or patients have cried in my COVID recovery clinic because they're just so relieved to find somebody who will spend the time listening to them. I'm very open about the fact that I may not have all the answers, but I will try, and we'll do the best we can to care for their kid. And they're just so relieved to know that a doctor is listening to them, is willing to work with them and to try to help them feel better. We keep boxes of tissues because they cry. I mean, 2-3 times a day, I make people cry, but they're crying in relief, and they're crying happy tears because they finally found someone who will listen.
Absolutely. Even as you mentioned, even if you don't have all the answers, at least you're there to be supportive and to believe that you're going to do everything you can to help them. Absolutely. But, let's play devil's advocate for a little bit here. For those skeptics out there, let's indulge them for a moment. How do we know that long COVID is real in kids and teens? Just how prevalent is it in the pediatric population?
So I'll take that one to start with. I think there's a lot of different information out there, and you can see population estimates in kids anywhere from 4% of kids who get COVID have long COVID up to about a quarter, so 25% of kids. So a very wide range of estimates, and I think it depends on how you define long COVID. As we've already talked about, there's a definition for sure, but it's not one that you can do a lab test for. It's not one that we can say, okay, this lab test came back high, so therefore you have long COVID. So I think there's still, some difficulty with even making that diagnosis. And then on top of that, having parents not be listened to, families not be listened to, and then believed or getting all of these other diagnoses is a problem. As far as how do we know it's real, I think you only have to see a few of these families and it's real. I think all of us would say it's real. I think that the characteristics of these problems of long COVID and what it causes are similar. There are different, as has already been stated, there are different kind of appearances, but they all come in very similar categories. There's, at least for us, there's kind of a neuro headachy pain grouping that we tend to have. There's more of a dysautonomia, which would be dizziness, passing out grouping that we would have, and that we see kids fall into. And then there's kind of more of a GI stomach pain kind of group. They can intermingle for sure, but they tend to fall in those three groups. And I think we've just seen it over and over and over again, to the point where there's something going on, whether or not we have that ability yet to define it and to find that perfect test or that perfect treatment. We aren't there yet. But I think we are here because we know it's real, and trying to get that education piece out there for everyone else, I think is so important.
Absolutely. And that kind of brings us to that next question. You had mentioned neurological symptoms and GI symptoms, and really that spectrum, and really that how there are certain hallmark symptoms that you're seeing in your patient population that come through your clinic. But I'm curious, just how debilitating can it be? So based on your experience and based on all the patients you've seen, can you talk a little bit about how this impacts their daily life?
Of course. So I think, we've already discussed the fact that by the time families get to us, they are beyond frustrated. Tears of relief of the fact that someone's listening to them, the fact that someone believes them and is working with them. So I think there's a lot that's been built up by the time they kind of get to us. Many of these kids are struggling in school. They can't do the things that they want to do with their friends. They aren't, as the family stated before, they aren't able to play sports. They aren't able to do those normal things that kids should be doing. We have had, at least that we've documented, we've had about 32% of our kids where there's been some level of discussion of homebound schooling or alternative modalities of schooling. That is a huge number of kids that are being taken out of their normal population, of their normal social emotional development, and being forced, or by lack of ability to make them better, or treatment at this point, to exist in a non-ideal situation. Of that, about 32%, I think we've had about 23%, 24% that have actually been put on homebound. And what homebound means for us is that they are at home. They get usually a teacher that comes to the house for a few hours a week, not necessarily every day, but usually it's a couple hours, a couple of days a week. And it can be more tailored to what the kiddo can do. That's the most common. Some also are put on virtual school. So they're back to this virtual school modality that was not ideal before, is not ideal now, but it's what they can do at the time. So I think that this is taking a huge toll at every level, from a social standpoint, from an emotional standpoint, development standpoint, education standpoint on these kids. And as we already saw, on the families too. The kids aren't the same as they were before. The sparkle is gone from their eyes, and that's what we're working to get back.
Absolutely. And Dr. Malone, you're working with a whole spectrum of patients as well, working with them on regaining their neurological function, their physical functioning as well. So you can really see that spectrum of just how debilitating long COVID is. Can you talk about it from your perspective?
Sure. I think that we have a very similar sort of experience, that some patients that have long COVID are able to still go to school, able to participate in their activities, but they just feel like something's still not right. But then on the other end of the spectrum, there are, adolescents that were high achieving athletes, on the star on the team and performing very well at school, that now has difficulty being able to walk to the mailbox or walk their dog around the neighborhood, those types of things. So there is such a range of not only symptoms, but also the severity of those symptoms. And that has different impacts for different children and adolescents. And so really it's about so much individualizing the care, focusing on what activities is really important for the child to participate in. And if they only have so much energy or so much, ability to sort of perform with regards to their symptoms, what do we prioritize and how do we make them be able to perform in school, perform the things that are important to them, but supporting them from the outside with accommodations, with medications, with sort of other types of therapy. And so that requires a lot of sort of specific individualized care for every child, but it can have a huge impact. And it can have a huge impact not only on their functioning, but also their mood. And it can be a huge stark departure from where they were before.
Definitely. And I want to talk about the mental health aspect as well, because that is such a key component here. But before we get to that, let's talk about risk factors. Dr. Hassan, I know that you've mentioned in our previous conversation certain things that you're seeing and you're learning. So can you tell us what we're finding out about kids who get long COVID and why a certain group of kids gets it?
Sure. So, when all of us first started our long COVID clinics here, we anticipated it was going to be the kids who required prolonged hospitalization or were critically ill in the ICU, requiring ventilatory support, or having, horrific COVID pneumonias or a multi-system inflammatory syndrome. And for the most part, when we first started our clinics, these were the kids that we were starting to see. The vast majority of kids with long COVID that I've seen have been unvaccinated children. And, we anticipated, just like with chronic fatigue, females tend to be impacted more severely. We are starting to see a little bit of that. And some of these kids had underlying risk factors, that they had a history of eczema or asthma or atopy. But what was surprising was the kids who came in from the community. When I first started my clinic, I anticipated it was going to be all hospital follow-ups, and we would be following them for a good 6 months to a year to see how they would fare. Surprisingly, we started getting a lot of referrals, kids who had mild or asymptomatic COVID, who about a month out after their episode were starting to become dysfunctional because of headaches or fatigue, or not being able to process information, or having brain fog, or having dizzy spells where they couldn't function. And surprisingly, these were I call them the hyperachievers. They do everything right. Straight A students, AP classes, they are into competitive dancing or gymnasts or competitive sports. playing multiple sports in the day, and they cannot power through with a single game. And they see this as a failure in their own self, that they are not able to do so, which was the biggest struggle for them. A lot of them had severe anxiety and depression because of that, and you could truly see that they were struggling to get back on their feet. They really wanted to get back to school. They would get labeled as they're trying to get away from school, they just want to take a break, things like that. So it was really a learning journey for me when I first started caring for these children.
Absolutely. And that kind of brings us to another question about how on earth do we treat long COVID? Because it's certainly not a clear, straightforward answer, even though we all wish we had a silver bullet for it. So Dr. Edwards, can you talk about how you're treating these patients and what types of treatments you found to be the most effective?
So the way we approach long COVID in our clinic, we kind of approach it two ways. One, we want to work to control the symptoms so that the patient can be functional. We know that that's not optimal. Obviously, we'd prefer to cure them. So with the autonomic instability or the autonomic dysfunction, there's some diet modifications around fluid and salt. There's some medications like fludrocortisone or midodrine that might work. And then we actually on Dr. Malone's recommendation, we've started an autonomic rehabilitation program at our hospital as well, which is working really well for a specific subgroup of patients. So it's about symptom control. For our headaches, we have acupuncture and massage therapy, because as the mom in the story mentioned, a lot of the typical painkillers don't work for these kids' pain. We might use stimulants for the brain fog, and just a variety of different pacing to help with energy management, sleep hygiene to help work with the sleep disruption, diet modification to decrease inflammation in the body. We work on like whole food, like Mediterranean or anti-inflammatory diets. So it's kind of a mishmash of lifestyle modifications and some medications and different things to really try to control the symptoms. And our hope is that if we control their symptoms really well, then maybe the fact that these kids are young and healthy, like their bodies can bounce back and heal themselves. And I will say that does seem to hold true. I would say that for about 50 to 60% of our kids, after 6 months or 9 months of, kind of wraparound support, we have mental health services at our long COVID clinic. We have we do Western medicine and Eastern medicine. We have pulmonology, cardiology, we have the whole gamut in our long COVID clinic, and a lot of them do discharge because they feel fully well. But then there is a subset of patients that we manage chronically. And yeah, we can get them feeling better. Sometimes we can give them tools to get through their worst days, but they kind of just keep lingering and they don't get better. And those are the kids that I'm genuinely worried about, and that I hope one day that we do find like a real solid cure instead of kind of this mishmash of trying a bunch of experimenting, I call it.
Right. And you mentioned that it was part of Dr. Malone's advice. So Dr. Malone, is there anything else that you're doing at Kennedy Krieger to help treat these patients?
I think a lot of the things that Dr. Edwards mentioned is how we approach it as well. Really an individualized approach to every patient is important, using the combination of the lifestyle, the medications, and things like physical therapy can be really helpful as well. And there are, medications that for symptom management that we're trying that in some of the adult communities are also being used as well, that have had other uses and we're trying in these patients. So it really depends on the patient, but overall it's sort of the same approach that we have right now until we know a little bit more maybe about a medication that hopefully one day will cure long COVID.
Right. Now, Dr. Hassan, you've mentioned in our conversation something very interesting, that the COVID vaccine can actually be used as a potential treatment. Can you tell us more about that, and why does that seem to be doing the trick here with certain long COVID patients?
I'll tell you that there's some emerging data around that. And if you look at the adult data, it's like a 50-50 mix. Does it really do anything? But I'll tell you anecdotally, in the kids in our clinic that we have seen post-vaccination, we really see an improvement in symptoms. And actually about 4 to 6 weeks out, I would say post the first dose of the vaccine, you start to see them get better. There's various theories emerging on why this happens. Is there some sort of autoimmune process that's offset by the vaccination? Do they have a hidden viral reservoir that's neutralized? There's lots of theories on what kind of immune alterations these children have. But anecdotally, I'll tell you that the vast majority of kids who have gotten vaccinated, I would say about 6 to 8 weeks later, we really see a significant improvement in their symptoms.
It's really, really interesting. And so for Dr. Sexton-Tejtel, over at Texas Children's, is there anything out of the box, anything unique or innovative that you're trying?
I think all of this is out of the box because I think we're all trying to figure it out as we go. I agree that individualized care is very important. We have also seen that some kids do get better after vaccination. The other thing I guess that I would add to this is there has been some question about COVID treatment, Paxlovid. Would that provide any benefit in these kids? And again, it's all anecdotal at this point. We have seen some improvement after it. I think the problem with anecdotal is it doesn't necessarily pan out in the end. And is it just that they were going to get better at around that time anyway? Or was there really a benefit from that treatment? A lot of kids don't qualify for Paxlovid either. So I think that's the other side of this, that's a very small subgroup of kids that you potentially could try this in. But that is another thing that we have tried that on a few occasions, not one or two, but a few occasions has seemed to help.
It seems to be raising more questions than answers. Now, another question then I have for you is that we hear a lot about repeat infections of COVID in the adult population, but I'm curious what that means for kids. How does that translate to our pediatric population? So Dr. Edwards, if kids have had COVID but never developed long COVID, does that mean they're out of the woods? And what role does that repeat infection play in all of that?
That's a really, really good question. And so what I would say is, post Omicron, so in 2022 and into 2023, what we have seen, a pattern that we have definitely seen emerge is, a kid had COVID at some point, they were fine, they got better, they get COVID again, maybe they don't feel great, but they're okay, they get COVID again, and that's when they slip into long COVID. So it does not, now what rate they do that, are some of them protected and only a smaller percent are getting long COVID after the second or third infection? We do not know. Are more getting it? Does repeat infections increase your risk? We have no idea. This is just me anecdotally in my clinic noticing that repeat infections can lead to long COVID. The other thing that I'm seeing, especially this winter through the end of 2022 and into 2023, is they got COVID and then they did okay, maybe even fine, and then they get like a really bad strep infection or a really bad flu or bad pneumonia, which, I mean, all of us who have done infectious disease know that these infections kids recover from, right? They're fine. But after they get that bad strep infection or that bad pneumonia, they don't. They slip into almost like a long COVID picture, even though it wasn't COVID that acutely triggered it in the moment. They had a recent history in the last 3 or 4 months of having had COVID. So, as Dr. Hassan said, like there's something, COVID's doing something probably to the immune system is my best guess, just based on kind of what I see anecdotally in clinic. And it's not just right then in that COVID infection, it's future infections and sometimes even non-COVID infections, in the time frame right after the COVID infection that can be the problem.
Absolutely. And you've mentioned in our previous question that you're seeing that approximately 50 to 60% of the patients that you treat get better around 9 months. That's correct?
Yeah.
So what is the future outlook? What is the prognosis for pediatric long COVID patients? Do they need to take special precautions to make sure that they don't get COVID again? What does it look like for them?
So we've got a couple patterns that we've seen. We've definitely seen some kids who seem to return to full function. So as best we can guess, they're cured. I don't know, and they don't relapse. We never see them again. 2 years out, they're gone. I've still never seen them. But then there's another pattern where the kid gets completely better from their long COVID, and then they get COVID again, and they relapse, and they come back to the long COVID clinic. In my experience, the further the kid is out from when they recovered from long COVID, the less likely they are to relapse. Like if you can keep going without relapsing, then you seem to kind of get stronger with time, and then you're less likely to relapse. But we don't know the ultimate prognosis because it's so multifactorial. So yes, there is the physical damage that long COVID is doing to the brain and the body during the actual process of having long COVID. But what about all the school that they missed, all the friends that they missed hanging out with, all the fun that they would have had, the proms, the sports events, the thises and the that's that they're missing. So even if they return to perfectly full health after 2 years and their body is perfect after that, what about the 2 years that they missed? What is that going to do long term for their development, for their health, for their mental well-being? So we have a lot of questions about the long-term prognosis for these kids, and there's very little being done to address it so far globally, except for in these small isolated clinics.
Right, right. And Marcy, the mother we heard at the beginning of this event, had mentioned in our conversations that her daughter overall has kept a very positive attitude throughout this whole ordeal, but she can tell her daughter, has felt down and depressed at times. So given that you all see patients and their families, like you had mentioned, in such a difficult situation, they don't know what they're going to be like in the future because of those missed years. I imagine you're also witnessing that psychological toll. So Dr. Malone, can you talk about that psychological and mental health impact of long COVID on your patients?
Sure. I mean, as we've been talking about through much of the webinar, that for many children, getting long COVID is a stark departure from how they were a month ago, a year ago. And so it really affects their lifestyle, it affects their activities. And so children have mood changes as a result of not being able to participate in the things that they wanted to. And they'll have symptoms of anxiety, depression, irritability, and it's all very understandable. And there's some studies that suggest that, developing anxiety or depression as part of long COVID is a real symptom of it as well. And so there is a huge interplay between the physical symptoms and the mental health symptoms. And so really our approach is to address them all sort of simultaneously, because if you're only addressing one piece to the puzzle, it's really hard to make a significant change and improvement. And so, we're helping kids try and get back to their sports, their club, their social activities. And that requires the medications that we talked about, that requires physical therapy, but that also requires mental health support. And sometimes that requires medications. And so, I think that it's really important to address both and to not put it necessarily in one bucket or the other, because there's interplay in both directions that is really important to address, and that it is real, but the mental health effects are also real and important to look at.
And I would add to that, it's not just the mental health effects on the kiddo, it's the mental health effects on the entire family. The kids are not their kids are not the same kid that they had a month ago. They're not the same brother, they're not the same sister. And that anxiety and the mental health effects, as well as the physical health effects, I think really play a big role in changing family dynamics. And so it's not just the one kiddo with long COVID either.
That must be very heartbreaking to see, especially as you're dealing with all of these kids from, an early age and dealing with all the constellation of symptoms. Dr. Hassan, was there anything that you wanted to add to that?
I think I would reiterate the same. Time and again, we've seen parents who are at their wits' end, because one, they have to prove to the providers that there is something really wrong with that child, and they just keep getting labeled as, this is a figment of his imagination. He's going to get over it. He needs to man up, get back to school. So I think that the need for support for these families and for these children is tremendous.
Absolutely. And you're all running pediatric long COVID clinics, but you each come from different specialties. Dr. Edwards and Dr. Hassan, you're both infectious disease specialists. Dr. Malone, you're a pediatric neurologist, and Dr. Sexton-Tetchell, you're a pediatric cardiologist. So you're all coming at this long COVID problem from all different angles. But I imagine there are a lot of shared challenges as well, as you have all mentioned. Dr. Edwards, can you kind of start us off? What are some of the biggest challenges you're facing, and what do we need to do now?
That is a really great question. So I established my clinic I saw my first patient in November of 2020. I am an infectious disease doctor. I'm not used to managing chronic illnesses. And it was a long, hard road to kind of establish the clinic, pull in the people that I needed. I now have a care coordinator. I loved, I'm sorry, I can't remember it. The mom of the patient showed that notebook with those medical records. We see that again and again. So we actually have a care coordinator who schedules all the appointments for our patients, because these families are very overwhelmed. And what I would say that we need, and what's the most challenging, is just the sheer volume. So for instance, in my state, estimates based on what percent of kids we think have long COVID is that in my state, somewhere between 30,000 and 70,000 children have long COVID. In my clinic, since I started in November of 2020, I have seen 256. So that's not a lot, but for me personally, it's a lot, and I'm overwhelmed. I'm burned out. I see kids in my administration time. I see them in the nights. I see, I'm cramming them in everywhere I can. But I can't, even within just my state, I can't possibly see them all. We need help from state, local, federal officials. We need help from the schools. A lot of these kids struggle with schooling. I'm glad Dr. Sexton-Trejold that you mentioned that. We also, probably about 30% of kids, I agree with that number, need some alternative forms of schooling. We have kids that do partial days in person, partial days at home for if the school is amazing and flexible and willing to work with us, because we know how important it is for them to be in person. So we need help from the Department of Education. We need help from our local education officials and schools. We need help from, the Department of Health to get this, just from a public health standpoint, to get our mind around what even we're dealing with. A lot of these kids haven't even been identified yet. We need funding from the federal government to establish more clinics, to get training, to get resources for physicians, nurses, care coordinators, everything. We need everything.
I'm seeing a lot of head nodding here too. Dr. Malone, do you have anything to add to some of the challenges that you're experiencing?
Yeah, I think that, there are a lot of patients out there that are trying to, especially pediatrics, they don't live locally to, a pediatric long COVID center. We all come from those, but there's many states in the United States that doesn't exist. And so more clinics is really important, but to do that, it requires additional resources because, like we've talked about, there's many symptoms that you're trying to balance. It's not a quick 15-minute appointment talking about one focused problem. That's not long COVID. And so thinking about clinical care models where you can spend the time with the patient and do what you need to do and have that be, an option for institutions and hospital systems and things, I think is really important. And I just second everything that sort of Dr. Edwards said that we need moving forward.
Dr. Sexton-Tetchell, Dr. Hassan, do you have anything else to add to that?
I think she alluded to it, but I don't know that she specifically addressed it. I would agree with everything that Dr. Edwards said, and I would add research, and more research. We have to know what causes this. We have to know we have to find those key things that make it better. So I think there's, the patient care, which is what we're all in the midst of right now and just trying to make it through. But we've got to have that other side too, so that it helps that patient care side get easier, hopefully, more effective.
And I think that going in line with sort of the research is, each of our institutions can only see so many patients. And so larger networks of collaborations amongst institutions, because it's so multifaceted, is really important. And facilitating those is, I think, the way forward.
Absolutely. And given how much it takes to take care of these patients, you've all mentioned a very holistic approach to managing the symptoms, treating the symptoms, and helping these families really get through all the struggles that they have to deal with in taking care of their kids. It raises a very important question of how to pay for it. Dr. Hassan, is insurance covering the treatments your patients need? And what message do you have for payers based on your experience?
I think all of us have said this multiple times over that, a multifaceted approach, a multidisciplinary approach is essential for successfully caring for these kids and for them to get back to normal functioning. Some of the challenges that we face are things like psychotherapy, physical therapy, neurocognitive evaluations sometimes may not be covered by insurance, and to convey that message that this is a real illness. This is not children running away from school. This is not them pretending. This is not just a teenage child, which is the feedback sometimes that we get. Often we've had to write letters of medical necessity saying that this is an absolutely needed service. And just to make that point across that, we really have to do our due diligence and get them the care that they need. And so whatever it takes to support them. Often the other struggles that the parents have is that, they are having to look for in-network support a lot of times for things like behavioral health support with this huge crisis that we are seeing now. There should be some allowance. If the child needs immediate care, they need immediate care. They should not have to wait for 4 months for care for their child. So those are some of the struggles that we're seeing.
Right. And waiting 4 months just seems like far too long. As some of you had already mentioned before, that delayed diagnosis, or rather the delayed treatment, can have much longer negative effects on the kid's development. And I think we have time for a couple more questions here, but I also want to address the advice that you might have for people in our audience, especially ones who might be interested in starting their own long COVID clinic for pediatric patients. And really, it sounds like you would all agree that we need more long COVID clinics for children. So what is your biggest piece of advice for those who would like to establish a long COVID clinic for kids?
Well, my first advice would be to make sure that you have the support of whoever, if you're in a hospital system, so whoever, manages your hospital system or whatever, because if you don't have the support of your hospital system, it's really going to be an uphill battle. I would say that you definitely have to have at least one provider from each subspecialty in your area who's willing to focus at least partially on long COVID kids. So I mentioned it earlier, I have a gastroenterologist, I have a cardiologist, I have psychs, behavioral health, neuropsych, all the different nutrition, et cetera, et cetera. Now they do other things. They see patients besides long COVID patients, but they have agreed to specifically see long COVID kids because repetition helps breed familiarity with the illness and how to manage it. You know, back in the early days in 2020, we had no idea what we were doing. We made a lot of mistakes, but we've learned and learned and learned, and we have better ways to manage these kids now. So as opposed to just sending them to any random cardiologist or any random pulmonologist, really making sure to identify a couple of people within each subspecialty that are willing and able to focus on long COVID, and then have a care coordinator or a nurse who can at least have an advice line running, even if it's just during the daytime hours. These parents need a lot of support and help, who can help coordinate the appointments, schedule the appointments. I would strongly advise a virtual option. If you don't already have one, put in place a virtual option. A lot of these kids, especially if they're going through a really bad crash or a really bad period of time, may not really be able to get out to see a bunch of doctors. And so having that virtual option available at least part of the time can really help with their energy management. And yeah, hopefully have a lot of money so you can pay for all of that.
And I think I would add to that, I completely agree with everything that was said, but I would add having all of those doctors in the same place at the same time. Because I think the family already said going to doctor's appointments every day, that if the kids are still in school, that's taking them out of school and out of their social interaction even more. So the more that we can have all of this care as consolidated as we can get it, which adds cost and time and all of those types of things potentially as well. But one of the things I think we've also benefited from that kind of model where we all come together and see most of these kids at the same time is that we communicate better. And so I think establishing that kind of program where we can then communicate amongst ourselves and kind of make some decisions about care management, not have the family have to, like the mom in the earlier said, she was the one that was having to say the doctor didn't want the kiddo on a certain medication. We can have those conversations. So getting the support to have that type of thing, I think is ideal. As we've talked about, that takes a lot of support, both locally as well as nationally, and a lot of time too.
Absolutely. And I'm curious about this one aspect too, about parents dealing with the future outlook of COVID in general, not just long COVID. Should parents still be taking every precaution to ensure that kids avoid getting COVID in the first place? And is that realistic in today's climate?
I mean, I'm an infectious disease doctor, so I always love it when kids don't get infected. So yes, you should still be taking precautions to make sure your kids don't get COVID. Obviously, that's going to be different depending on where you are and when you are. There are times when COVID isn't very prevalent. Right now, where I am, it's not very prevalent. We're in a very nice, lovely valley that I hope continues indefinitely. Simple things you can do. We hand wash in my house every day before we leave and every day when we come back. When we're in high risk environments, we still mask as a family. And I will say that neither me, my husband, or either of my kids have ever had COVID. And we intend to continue that as long as possible because I am not dealing with long COVID in my family. Yeah, I mean, do what you can. Obviously, we don't live in a perfect world, so a lot of it is outside of your control, but continuing to advocate for, proper ventilation in schools, proper protocols to be in place for making sure sick children are staying home when they're sick, things like that, with your local school boards and things like that. There's a lot that you can do, if you're willing.
That's really good advice. And it looks like we have a couple minutes left. So I do want to give you all an opportunity before we close out the session. Is there a final call to action you'd like to leave people with, final thought or a final message?
I would say for any generalists out there, like general pediatrician, family medicine practitioner, whatever, even if you can't do the work to set up like a whole big long COVID clinic, and I know that sounds really daunting, so that's fine. Listening to your patients, believing them, validating, helping as much as you can to control as many symptoms as you can at least help the problem. And so, yeah, just If everybody even does a little bit, it would go a long way.
And I think there's always opportunities to reach out. We can't take care of 70,000 kids, even amongst all of the clinics that we have. And that's only one state, not all of our states. But reaching out, there are people that are doing this, and there's some of this that can be done in the medical home. And if we can get to it faster, that may be the best place for it to happen.
Certainly. Dr. Malone, Dr. Hassan, any final thoughts?
I think not anything too different, just sort of agreeing with everything else that has been said, the importance of validation. And I think also keeping in mind that sometimes we just want to push kids back to their lives, and that doesn't always work. And so I think pacing is really important in some patients. And so even from very early on, not pushing them too hard, especially the first time that you're seeing them and things with regards to their activities, is really important, because you want to avoid crashes and sort of a worsening of symptoms.
I think that all of us brought this up too, but caring for the family as a whole is a huge part of this process. That's the one parent, single parent who's taken off the day of work, and this child is going to be going to 8 appointments. We try our hardest to make sure that it's a one-stop shop if we can make that happen, just because it takes its toll both on the child and the family. And so whatever we can do to make things easier for them.
Absolutely. And it sounds like ultimately there's still a lot of work that needs to be done in this field to make sure that our pediatric population and the families, as you all have mentioned, get the care that they need, get the care and support they need. And so we've covered a lot of key topics and issues regarding long COVID here today. So thank you all so much for taking the time to share your knowledge, your advice, and your insight with us all. And thank you to our audience for joining us here today. That's a wrap.